Duane retraction syndrome. Duane 1 is characterized by narrowing of the palpebral fissure and retraction of the globe on attempt adduction, esotropia or orthotropia, limitation of abduction, normal adduction, and frequently associated with upshoot and downshoot of the adducted eye. Duane 2 is characterized by narrowing of the palpebral fissure and retraction of the globe on attempted adduction, exotropia or orthotropia, limitation of adduction, normal abduction, and frequently associated with upshoot and downshoot of the adducted eye. Duane 3 is characterized by narrowing of the palpebral fissure and retraction of the globe on attempted adduction, esotropia, exotropia or orthotropia, limitation of both abduction and adduction, and frequently associated with upshoot and downshoot of the adducted eye. Brown syndrome is characterized by limitation of elevation of the adducted eye. The clinical picture resembled a paralysis of the inferior oblique muscle, but the forced adduction test showed resistance to elevation of the adducted eye. Adherence syndrome is a developmental anomalies of extraocular muscles in which the sheaths of the lateral rectus and inferior oblique muscles and those of the superior rectus and the superior oblique muscles are adherent. Patients with this syndrome have hypertropia in primary position, restricted elevation, and a positive traction test. Strabismus fixus is a rare condition in which one or both eyes are anchored in a position of extreme adduction, that is convergent strabismus fixus, or in position of extreme abduction, that is divergent strabismus fixus. The involved eye is and cannot be moved, and the forced adduction test will confirm the immobility of the eye. Acquired strabismus fixus has been reported in conjunction with amyloidosis and in patients with high myopia known as myopic strabismus fixus. The cause of strabismus in high myopes is the disproportion between the size of the orbit and the volume of an enlarged or elongated myopic globe. The affected eye is esotropic and shows a generalized restriction of motility in several gaze directions. Forced adduction testing showed mechanical restriction of ocular motility in all peripheral gaze positions. Congenital fibrosis of the extraocular muscles is characterized by downward fixation of one or both eyes, marked ptosis, chin elevation and perverted convergence movements on attempts to look upward or to either side. Graves' ophthalmopathy is an autoimmune inflammatory disease that may cause limitation of ocular motility, most commonly a restriction of elevation, and limitation of abduction. Graves' ophthalmopathy is caused by myopathy of the medial and superior rectus, respectively. The lateral rectus muscle is least commonly involved. Acute orbital myositis belongs to a subgroup of nonspecific orbital pseudotumors, and its etiology remains obscure, although immunologic mechanisms have been postulated. Limitation of ocular motility is a common finding and may consist of restriction of adductions in the field of action of the involved muscle. Cyclic heterotropia is a rare form of strabismus. Apparently depends on a regular clock mechanism that usually follows a 48-hour rhythm, that is, a 24-hour period of normal binocular vision is followed by 24 hours of manifest heterotropia. Acquired motor fusion deficiency is absence of fusional convergence, divergence or both. It occurs after closed head trauma, cerebrovascular accident, intracranial tumors, and after brain surgery. In blowout fracture of the orbital floor, orbital contents such as fat, fascia, the inferior rectus and oblique muscles may prolapse into the maxillary antrum, or part of these tissues may become incarcerated in the fracture site. Marked limitation of eye movements, particularly elevation, depression, or both, are common findings. The forced adduction test will demonstrate limitation of elevation. In fracture of the medial orbital wall, abduction will be limited or even absent. The forced duction test showed that the eye could not be moved at all by passive force. Superior oblique myokymia is an episodic nystagmoid intuition and depression of one eye. There is high frequency and low amplitude torsional and vertical oscillations of the affected eye during an attack. Ocular myasthenia gravis is an acquired autoimmune disease, affecting the neuromuscular junction in which the number of acetylcholine receptors is decreased. Ptosis is asymmetrical, unilateral or bilateral. The motility disturbances may affect any or all of the extraocular muscles. Coogan's lid sign is a helpful diagnostic. After rapidly and repeatedly looking from downward gaze into the primary position, the upper lids will elevate excessively for a brief moment and may twitch several times. Chronic progressive external ophthalmoplegia is a rare progressive disorder that affects bilateral ocular motility and the levator palpebrae muscle. It is characterized by bilateral ptosis and decreasing motility of the eyes in all directions of gaze.